The outbreak has shown no mercy to the elderly. This is the 18th coronavirus-related death at this long-term care home. Facilities like these are being pushed to the front line of the pandemic as COVID-19 now takes two diverging paths in Ontario. One's getting worse, but for everyone else, it's at its peak.
Peaks are not a single day. Peaks are not sort of a nice single sort of spike. They can be a little bit bumpy. They can prolong for a period of time, particularly given public health interventions. But we're in that peak period right now.
Even though new daily cases of COVID-19 are climbing, that rate of growth has slowed in the wider community, suggesting Ontario's emergency isolation measures are working. At first, the province had projected 80,000 cases by the end of the outbreak. Today, it revised that down to just 20,000. It also initially estimated at least 900 ICU beds needed by the end of April. Now, it's less than 400. That demand for critical care has shifted to long-term care homes, where the province only days ago introduced new measures, including restrictions on employees working in multiple homes.
Hindsight's 2020. But I think we're paying for what was in long-term care really a flat-footed response.
With the uncertainty surrounding long-term care homes, the Premier says it's too soon to even talk about getting back to normal.
Hang in there, continue social distancing, continue practicing the protocols from the Chief Medical Officer. We'll get there. And I know some people are getting, as I said before, cabin fever, and they're getting a little antsy. But we can't jump ahead.
So far, Ontario is being spared the exponential explosion of cases seen in New York and Italy. But officials here still worry about how quickly things could change, especially for the most vulnerable. Vic Adopia, CBC News, Toronto.